Ava. I'm going to be your NP student for today, and I'm going to be doing your physical exam. Can I please have your name and date of birth, please?
0903-2000.
Okay, great. Now, can you please tell me where you are?
The medical office.
Okay, great. Patient is alert and oriented ×3. The patient looks well nourished and no signs of distress or discharge. No. Now I'm going to be inspecting your head. Head is normal cephalic. Hair distribution is equal. Scalp has no flakes. Now I'm going to palpate. No lesions, no masses. Any tenderness?
No.
Okay, great. Face is symmetrical. Face is symmetrical. No droopiness, no edema. No signs of hirsutism. Now I'm going to just palpate your temporal artery. Any tenderness?
No.
Okay, temporal artery is 2+, and no tenderness. Okay, now for the eyes, I'm going to be inspecting your visual acuity. Do you wear glasses?
No.
Okay, now cover your right eye for me. Now read this bottom line for me, please.
LTFPH.
And now do the same for your left eye and read it backwards, please.
HPFTL.
Okay, great. Visual acuity is 20/20 bilaterally. Now I'm going to be inspecting your eyes. So your eyes are aligned and symmetrical. Eyebrows and eyelashes are full and symmetrical. Eyelids are symmetrical with no signs of swelling or ptosis. The medial and lateral canthus are intact with no signs of swelling, discharge. And their lacrimal system is intact with no signs of swelling or discharge. Now I'm going to be lifting your eyelids, please, to check for conjunctiva. Please look down for me. Now please look up for me. Okay, great. So conjunctiva is pink and moist. The sclera is white bilaterally, and the cornea is clear and with no opacities. The iris is brown, and the pupils are equal and round with 3 millimeters in diameter. Now I'm going to be inspecting your pupils for direct and concentric light. I'm going to be shining right into your right eye, and now your left eye, and then I'm going to do the same again. Okay, so your pupils are equal, round, reactive to light directly, and concentrically. Now I'm going to be testing for convergence. Follow my finger. Okay, great. Now I'm going to be checking for accommodation. Now look at the image behind me. Okay, now look at my finger. Okay, so pupils dilate when looking at a far object, and pupils constrict when looking at a nearby object. So accommodation is intact. Now I'm going to be checking your peripheral vision using confrontation. Now please look at my nose and cover your right eye. Now let me know when you see my hands.
I see. I see it.
Okay, do the same with the other eye. Keep looking at my nose.
I see it. I see it.
Okay, great. So peripheral vision is intact. Now I'm going to be checking your extraocular movements. Extraocular movements are intact, and cranial nerve 3, 4, and 6 are intact. Now I'm going to be performing a fundoscopic exam. I'm going to turn off the light. And I'm going to look at your right eye with my right eye. Orange reflex is present. Red-orange reflex is present. No black spots, no opacities in the lens and cornea of the right eye. Now I'm going to check the left eye with my left eye. No black spots, no opacities, and red-orange reflex is present. And retinal vessels are normal. No hemorrhages, no AV nicking. Optic disc is sharp with well-defined edges. No swelling or blurring of the disc margins. Cup to disc ratio is 1:2, which is normal. Now for this is the same bilaterally. Now for the nose, I'm going to be inspecting your nose. Now can you please cover one nostril for me and take a breath for me? Okay, now do the same for your left. Okay, great. Nostrils are patent. Now I'm going to be checking for smell. Can you close your eyes and cover your right nostril? Okay, what do you smell? Can you do the same for your other side, please? What do you smell? Okay, great. Olfactory nerve 1 is intact. Now I'm going to be palpating your nose. Any tenderness?
No.
Okay, now I'm going to palpate your maxillary and frontal sinuses. Any tenderness?
No.
Okay, now I'm going to be inspecting the inside of your nose. Looking at the right nostril. Nasal mucosa is pink and moist. There's no septal deviation, no perforation. No swelling, no lesions, and no masses, and no polyps. And now looking into the left nostril, there's no polyps, no perforation. Nasal mucosa pink and moist and intact. There's no discharge, and there's no swelling and no masses. Now moving on to the mouth. I'm gonna inspect your lips. Lips are pink and moist. Can I see your teeth? Smile. Teeth are all intact. Let me see your gums. Gums are pink and moist with no inflammation, with no bleeding. Now could you please I'm gonna ask you to open your mouth, please. Okay. Inspecting your buccal mucosa. Buccal mucosa is pink and moist bilaterally with no lesions or swelling. Now please take out your tongue for me. Tongue is midline, pink, moist, and no signs of swelling or lesions. Now please lift your tongue for me. Frenulum is intact and it's pink and moist. Now I'm going to be inspecting your palate. Hard palate is pink and moist. I'm going to also check your tonsils. Say ah for me. Okay, great. Tonsils are pink and moist, 2+ in size, and no swelling or exudate noted. Now I'm moving on to the ear. Now I'm going to be inspecting your hearing using the whisper test. Now can you please cover one ear for me? 1, 2, 3. Now cover your other ear for me. 1, 2, 3. Okay, great. Gross hearing is intact in both ears. Now I'm going to perform the Weber and Ryan test. So the Ryan test is I'm just going to strike the tuning fork on your mastoid process and you tell me when the vibrations stop. So, okay.
Stop.
Okay, great. So air conduction is greater than bone conduction. No conductive hearing loss. Now the Weber test. I'm gonna strike the tuning fork and place it on the midline of your head. Okay, so let me know when you hear the sound. On both ears?
Yes.
Okay, great. So sound is heard equally on both ears, no lateralization. There's no sensory neural hearing loss. Now I'm gonna be inspecting your auricles. Auricles are midline symmetrical, no lesions and no redness. Now I'm gonna palpate the mastoid process. Any tenderness?
No.
Now I'm gonna do your tragus nerve. Any tenderness?
No.
Okay, great. Now I'm gonna be pulling on your auricles. Any pain?
No.
Okay, great. Now I'm gonna be checking your inner ears. I'm gonna pull your auricle up and back. With the right ear, there's no signs of redness, discharge, erythema, or excessive cerumen. There's no perforation, no swelling, and no redness. The tympanic membrane is pearly gray and intact. The conobite is 4 o'clock, and malleus is visible. Okay. Now I'm going to do the left ear. For the left ear, there's no signs of drainage, no signs of inflammation or swelling. Tympanic membrane is intact, pearly gray, no bulging, no swelling or perforation, no scarring. Conobite is 7 o'clock, and is visitable, and so is the malleus. Now moving on to the neck. Neck is symmetrical, no bruising or redness or discoloration. No visible pulsations. Now I'm gonna palpate your lymph nodes, okay? This is the preauricular, the postauricular, occipital, tonsillar, submandibular, submental, superficial, deep cervical, posterior cervical, and supraclavicular. And any tenderness on any of them?
No.
Okay, great. Now I'm going to be palpating your trachea for tracheal deviation. Trachea is at midline without any deviation. Now I'm going to palpate the thyroid gland. Thyroid is symmetrical and normal in size with no nodules or lumps. Now I'm going to be inspecting your chest. Please, visible. No visible rashes, no lesions, no scarring or bruising, and no labored breathing visible. AP to lateral diameter is approximately 1:2 ratio, no burial chest appearance. Respirations are visible and no distress. Chest is symmetrical, no retractions or bulging. Now I'm going to be percussing. All areas resonant and no areas of dullness. Now please take a deep breath for me every time I put the stethoscope to your chest, okay? Okay, great. No adventitious sounds. No adventitious sounds, breath sounds present on all fields. I'm going to palpate the chest wall. Okay, no masses and no tenderness present. Now I'm going to be checking chest expansion. gonna place your hands on your lower back, please. Now, please take a deep breath in and out for me. Okay. All right. Great. Chest expansion is equal bilaterally and symmetrical. Now I'm gonna be checking for tactile firminitis. So when you feel my hands on your back, please just say 99.
99, 99, 99, 99.
Okay, great. Expected firminitis noted on vibration. Now I'm gonna be percuss on feels on back. Okay, all areas are resonant and no areas of dullness. Okay. Now I'm gonna be checking for diaphragmatic excursion. So please exhale fully. And then the second part is gonna be to hold your breath. So first exhale first. Okay, great. Now hold your breath. Okay, range is 3 to 5, which is normal. This is equal distance bilaterally. Now I'm gonna auscultate your posterior chest. Breath sounds are present in all areas and no adventitious sounds. Now I'm gonna auscultate for consolidation. So please say E when you feel my stethoscope on the back.
E, 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 E,
E sound heard as muffled and soft, no abnormal findings. Now I'm gonna auscultate and do the whisper pectoral test. Okay, so whisper 1, 2, 3. Every time I put the stethoscope to your back. So sounds are heard as faint and muffled and no abnormal findings. So this is the conclusion of our exam. Thank you.
Thank you.